So I'd like to talk to you about acid reflux or stomach acid that comes up in your throat. I see many patients who complain of chronic cough or clearing their throat, difficulty swallowing, the feeling of something stuck in your throat or mucus or phlegm caught in your throat that you can't swallow down. We call that globus sensation. Or you may have hoarseness, you may even have heartburn. All of those things are signs that you may have acid reflux or stomach acid that comes up in the back of your throat. And we call that laryngopharyngeal reflux or LPR. Uh, Laryngo is the medical term for larynx, which is voice box, and pharynx is the medical term for throat. So it's stomach acid in your throat, and it can cause all of those problems. So if you come to see me and you're not on medications like you may have heard of omeprazole, Protonix, Nexium, Prevacid, medications like that, those are medications that will help with acid reflux or stomach acid in your throat. And also medications like famotidine or cimetidine. Those are things that we might also put you on because they work different ways. And I look at your medication list, and because some medications you can't take with certain acid reflux medications, so I make sure that I look at your entire medication list. And then I discuss with you the things that may cause acid reflux. And sometimes you might get a scope in your nose so that I can see signs of stomach acid in your throat. And then I show those to you on video. Certain things like cobblestoning, which are bumps that look like a cobblestone sidewalk on the back of your throat, and then really thick mucus. Acid in your back of your throat causes your mucus to be really thick and sticky. So that's where you get that feeling of something caught in your throat you can't swallow down. So I will give you this pamphlet that talks about some of the symptoms that go through there, and so you can read through that when I give that to you. I also give you a pamphlet that gives you suggestions of foods that you should avoid, which makes your acid reflux worse. So for example, a lot of people feel like they're clearing their throat constantly, and so they use a mint, and actually mint makes your acid reflux worse. So we provide other suggestions for that. Then there are a few lifestyle changes. We could all lose a little bit of weight. The more weight that you have, the more acid, stomach acid you can have up in the back of your throat. Not eating right before you go to bed. So you want at least 3 to 4 hours after a meal before you lie down. And the reason why that is I may prescribe some medications that you have to take 20 to 30 minutes minimum before you eat anything. So I usually like you to take those medications in the morning. So when you get up in the morning, the first thing you do is take your acid reflux medication that I order for you, which might be omeprazole, for example. And then I always say, get up, go to the bathroom. If you have dogs, let the dogs out, start your coffee, go let the dogs back in. By that time, it's at least 20 minutes. And the reason why you have to wait is because the cells in your stomach that have acid pumps, when you eat or drink anything, the food and drink hits your stomach and the cells go, oh, food, and they pump out acid to start digesting your food. The medication works by turning those acid pumps off. So you need to take the medication first, let it work, let them shut those acid pumps off. Then 20 to 30 minutes later, you can eat, and then not as much acid comes out. You have other cells that produce acid. You still will have plenty of acid to digest your food. It's just these particular cells that have the acid pumps will be turned off and help you with some of the symptoms that you're experiencing. Another medication that I usually have you take at night, this one also should be on your bedstand or your nightstand next to your bed, because I want you to take it right before you go to bed. This works on a different cell in the stomach. And this one works on the cells where the receptor doors are open. So at night, when you lie flat If the receptor doors are open on that cell, it's going to pour out the acid out those receptor doors, and the acid's going to run up and down your esophagus while you lie flat at night and get up in the back of your throat and cause these problems. So I give you famotidine, which is Pepsid, and you take it right before you go to bed at night. It shuts those receptor doors on those cells, and then that just keeps the acid in the cells and doesn't let it come up and go up and down your esophagus all night long. So those are usually the things that I use to treat acid reflux. But again, I may have to work on the timing when you take it, because you can't take it close to thyroid medicine per se. And then some blood thinners, we have to be careful about adding those in. So I just look at your medication list and I give you these handouts. Another handout I give you, I know a lot of people don't like to be on a lot of medications, so I have an alternative reflux protocol sheet as well. So for example, sage tea can break a cough reflex. So if you're constantly doing that, maybe instead of caffeine, a Coke, a Diet Coke, or a regular Coke, you drink sage tea, because caffeinated beverages can lead to increased acid reflux. Drinking alkaline water versus the regular bottled water. Alkaline water is the water that you get in the stores that's labeled smart. It's your smart water, and it's a little bit more basic in nature, so it will help decrease some acid reflux. So I have a sheet for that as well. But all of these things will help with your symptoms such as coughing and clearing your throat, hoarseness, difficulty swallowing, sometimes like the feeling you have something caught right here, right below your voice box. We call that globus sensation, or the feeling that there's phlegm there. And you may even have heartburn. So you could have one of those symptoms, two of those symptoms, all of those symptoms, and then we try those medications.